should vote.
Yeah,
we should wait both.
Okay. All right, so I think we are ready to start. We are ready to start, so I'm going to welcome everybody to our regular school committee meeting. Thank you all for coming. It's always nice to have participation here in live. So we have just returned from an executive session, and we are ready to roll with our public meeting. So I would ask those who are able and interested to please rise as we say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, so the first item on our agenda is public comment. If there are people who would like to make a public comment, we do have, we limit to 3 minutes, and that we, for a total of 15. So if there's anybody that wants to come up, come on up. Okay. Thank you. All right, so you can come sit right here.
You can grab an extra chair.
Yeah, that way HCAM can pick it up on the mic, and if you guys want to come up too, you can bring a chair up with you if you want to. We're one short there. So, and I know you, Lee, but if you could just introduce yourself for our viewers at home.
Sure, Lee Burns. I have one child that recently graduated from Hopkinton Public Schools, and I have one that has just entered the Hopkinton High School as a freshman. I am here with friends, to shed some light and really some interest on the reason why the LTA policy is in front of you for review. So I did send an email to the school committee, which will have much more detail and points made than I would want to sit here and discuss this evening. But I just want to start with asking you a question. Can you tell me why the Hopkinton Teachers Association president / English teacher / homeroom teacher of a grade 8 classroom in which my son and at minimum one other nut allergy confirmed child, why would that person bring in on more than one occasion, as confirmed by your Hopkinton Public School investigation, why would she bring in a container of peanuts and leave it in the classroom? I'm not sure if any of you have any children, sibling, or maybe your siblings or cousins, friends, family, who have children who suffer from anaphylactic allergies. Anaphylaxis being, when it happens, it leads to death if not handled immediately, and at that point, there's no guarantees. Our community has already lost one student, a student athlete, to anaphylaxis due to an allergen consumed. I will say it again. My son is anaphylactic to nuts. It does not matter if the container is open, closed, upon his sight of the container. So when you read the question, don't say to me, why didn't he say something and why didn't he do something? Because I'm going to answer you this. He did. He asked another teacher to confirm whose container that was, and did they know that he's anaphylactic to nuts? He was in a nut-aware classroom. And the teacher said yes, it was the other person's container. And do you know the response of that teacher? Nate, stay away. Just stay away from the container. So my son did say something, and that's the response. So this is why, after my meeting with Dr. Kavanaugh and Alan Keller, this is why, after an investigation, the LTA policy is in front of you. And I will be working very closely to make sure that there's change in this school system. Thank you.
On behalf of Lee, my name is Michelle Levinson. I am a parent. I have a sophomore at the high school. My daughter currently graduated with Lee's older daughter. Lee and I have been working with this town to be aware of anaphylactic shock throughout this town and the schools. Some of you may know, I am an American Red Cross certified instructor. Anaphylactic is the scariest and most horrific thing any parent can go through, to worry about their child, dropping them off at school, making sure that they're safe. I teach these children every day when I teach their babysitting classes how important it is to make sure, if they have a friend, that they are safe with them, that there's nothing around them to make them ill. It is important that this be reviewed and the policy being very seriously taken care of. It is heart-wrenching to hear what Lee has gone to. She reached out to me and it brought me to tears. I have done anaphylactic on children. I'm telling you, it is not a pleasurable thing. I work with children from birth up until 5-year-old kids. It is not an easy thing to do, and it's not an easy thing to have to go through. And for Lee to have to worry about her son every day, it's heart-wrenching. And I'm here for her, and I can't express how much this really needs to be changed.
Thank you.
You're welcome.
Thank you. I look forward to working with all of you, making sure it's handled.
And as I'm sure you're aware, this is on our agenda to discuss the policy itself. Is there anyone else who had wanted to make a public comment?
I just want to say my name's Rebecca. My son is in the school system.
Can you actually move up a little closer so it gets
I
picked up?
can. Hi. For someone to feel that their child is unsafe in a school system should never have to happen. This is 2021. There's several policies in place. People are not unaware. People are very aware, especially in a nut-aware classroom. If you send your child to school, you want a safe area and safe place, and know that when you send your child to school, they feel safe. And for a child to come to their parent and tell them that they don't feel safe in their classroom should never exist ever. So,
I don't think I caught your full name for
Rebecca Hearn. Yeah.
Thank you.
Okay.
That moves us then, if there are not further public comments, into recognitions. Is there any recognitions that people have tonight?
I'd like to recognize Principal Keller for running the marathon this year in the October Boston Marathon. So I think that's great role model.
It's a big weekend coming up.
Yeah.
Different to have it in October. Okay, then that will bring us into student council reports. You guys want to come up?
Hello, I'm Jessie Ainelli. I'm a senior at Hopkinton High School and on student council. So I'll talk a little bit about what's going on in school in general. Everything is going well. At this point, everyone's pretty much in their groove with their classes and routines and everything into the school year. Recently, we had a number of students receive National Merit Letters of Commendation for their PSAT scores, and we had 2 National Merit semifinalists, Sarah Bouvier and Olivia Sword. So that was definitely very exciting. Next week on Friday, on the early release, we have our first ever fall senior transition day. Usually the last day of school for seniors is a series of workshops and life skill lessons. And Mr. Bishop received some feedback from recent alumni and graduates that some of these things would be more helpful earlier in the year. So we made that switch and decided to have one next Friday. And there's going to be a bunch of workshops about financial literacy, future career planning, college essays and applications, and mental health awareness. So that'll be super helpful, I think, for seniors in this phase of life. Sports are mid-season now, and volleyball is continuing to remain their undefeated streak of 12-0, so that's been a big source of excitement for students, and we've been getting a lot of fans at their games, which is great. Field hockey had their Keep Smiling game for the Abby Benford Foundation this past week, and that was a successful fundraiser, so that was great. And the booster store is open again, which has led to a lot of excitement in students as well. It's been nice to see people filing in there during lunch block and whatnot, and getting to see the school store open again. So that's all I have, and I'll turn it over to Ryan.
Hello, my name is Ryan Darbanga. I'm a junior at Hopkinton High School, And so in the past few weeks in student council, there have been different subcommittees, as I stated before in the last school meeting. And the subcommittee I'm in is an outreach subcommittee. So this time we sent our newsletter to the student body. So as you know, there's a student memo in the high school, but not everyone really reads it on a Sunday because, they'd rather do something else. So now we created a newsletter which contains like the key facts of what's happening in the school like each week. So we're gonna send it either bi-weekly or every week. And so for this, we also created a website for it, and it's a really big major breakthrough because as a school website, sometimes kids can find it hard to navigate through, and sometimes even the teachers can find it hard to navigate through the school website. So this new website that we created is very easy to access, and the students can use it very easily. It's called a student hub because it contains all your extracurriculars, the class schedules, and sports schedules. So it can really help students get a better understanding of how the high school functions, especially for freshmen. So for the volunteer subcommittee, we have picked official date of October 15th for the trash pickup, and it is on our early release. And for School Spirit, we're still brainstorming ideas for pep rally and for upcoming school day spirit events. And we're still gonna propose a pep rally in November, either outside or inside, for the Powder Puff game. And that's mostly it.
If you guys have any questions, let us know.
Yeah, that's great. Thanks for the update. And we also had a policy related to student involvement in decision making. Did you have any feedback for us on that? Is now the right time to ask?
So I
when
actually
that
was going to
policy
pull
comes
the
up?
policy out of order right
Yeah.
after we're done with the student
okay.
council so that we could have the feedback that they have.
Okay, so okay.
I think it's a great initiative to create a website to make things easier to access. I agree that sometimes I have a really difficult time getting to forms I need for my students. So I really think that's great. That's a huge amount of motivation as a group to get that done.
Thank you.
All good. I know, it's exciting to have you guys here. So I would like to go ahead and pull that out of order. I'm also aware we have Mr. McAuliffe here. Are we expecting anybody else for any of our guests for our other agenda items, just to be cognizant of?
I do not believe so, just Mr. McCullough.
All right, so I was going to go ahead with that, and then maybe we can bring Mr. McAuliffe up so that he's able to watch the rest from the comfort of his home. You're free to stay. So the policy is policy JIB, which is student involvement in decision making, and this is a fourth reading of this policy.
Yes, and it's a fourth reading because we wanted to ensure that U.S. students were able to see it after its third iteration. So we did not change any of the wording, but I do know that Mr. Bishop brought it to all of you, and my understanding is that Jesse, you would be our sort of ex officio member of the school committee. You'd be attending our meetings, and Ryan, you would be here in the event that Jesse can't be, correct? Mm-hmm. Yeah, so we're really happy to have you.
So happy to have you. Thank you.
Mm-hmm.
So we need to vote the policy.
So did you have anything you wanted to share from?
I'd like to ask
Yeah.
the student council representatives here if they had read the policy and if they have any suggestions on it.
I have read it. I think I don't have any suggestions. I think it's great. I think kids are very excited to be involved in student decisions and stuff like that this year after seeing how many decisions get made in this crazy last year of a pandemic. Everyone's definitely been very tuned in to the school committee recently. So I think it'll definitely get a lot of engagement and people will love the representation.
So happy to have you.
Yeah, and will you be planning to be here for the entire meeting?
Yes.
When you're here, okay,
Mhm.
including tonight.
Yeah, I can stay tonight.
Okay.
So
yeah.
we'll invite you just to stay up at the table after we've passed the
Yeah.
policy for the
Okay.
remainder of the meeting if you'd like.
Yeah, that's perfect.
Not to put you on the spot.
No, totally fine.
Were there any other comments? I know we had seemed like we were in a good place with it at the last meeting, but just wanted to be sure that the students had had an opportunity. So is there a motion to approve this policy?
So moved.
Motion by, Amanda, I'm looking at Meg. And is there a second?
Second.
Second by Meg. All those in favor?
Aye.
Any opposed? Abstentions? You are unanimously now with us here, so this is great. I would like then to invite Mr. McAuliffe up to talk, if that's okay. And then we will get to it.
Oh, yeah, we can slide over and you can bring his chair.
Name tag, yeah.
Yes, we are.
That way they can join us.
Good evening.
Welcome.
So,
Thank you so much for coming for this tonight. I know that your day is long.
and it's a, thank you for inviting me. And then, it's been a quite a busy year plus. And one of the things that just happened was I had a lengthy discussion with the DPH yesterday, knowing that this topic was going to be, it's going to be addressed to all of the health directors and health departments in the Commonwealth on Tuesday. So it was a good reason to get up in front of the board and kind of discuss, where we're at as a department and what our kind of opinion or recommendations are moving forward. So if you'd like, I can.
So I'm happy to contextualize everything. In a recent meeting with the Commissioner of Education, what he shared with superintendents was that if an individual school in your community had a vaccination rate that exceeded 80%, and that would involve the students, the teachers, the paraprofessionals, the cafeteria workers, the administration, so everyone in that building had to exceed the 80% mark, then as of October 18th, Monday, October 18th, essentially the school committee in that community could approve making sort of mask optional, allowing students to take their masks off, and that would be only for students who are fully vaccinated. And obviously, again, for teachers who are fully vaccinated. So fully vaccinated folks would be able to unmask. And what Desi is calling this is off-ramping. And so it's a very big decision to make, which is why we have asked our public health official, Mr. McAuliffe, to join us tonight and to give us, sort of some data and opinion.
Right. So, as Desi and the DPH have stated, it's a local decision to be made by the school committee and the district in consult with the local health officials. In Hopkinton, I just pulled the data today. Actually, I pulled a set of data that was released at 5 today. And in our district, we've got the 12 to 15-year-olds and the 16 to 19-year-olds. We're at over 95% fully vaccinated. So we've done a fantastic job here getting kids vaccinated on that. And we have a plan in place to work with the under 12 we hope in the next 3 weeks to have that underway. So we meet, at least for the students, we meet that threshold. There are several other key factors that have to be, or logistics that have to be addressed to comply with the full offboarding or off-ramping.
Yeah.
So yes, we're in a good spot. However, what we've been looking at locally is that let's see, we've got so we're above the 80% threshold, but not all students and professionals are vaccinated. We still have a significant population within the community that is traveling, and that travel is driving roughly 70% of our cases in town. We've had, just this week alone, I have at least 3 families that have approached me about the travel policy and how they need to navigate travel. And one of the things that we've been communicating is that the vast majority of people that have traveled have contracted COVID between their testing date and their return from their trip. And so with that in mind, with the increase in fall athletics, the fact that we're going into flu season or respiratory kind of virus season, the health department feels that it's prudent to stay the course with face coverings, at least until we get to a point where we can get our 12 and unders vaccinated above 80%. And we believe that, should be shortly before the Thanksgiving holiday. And then at that point, we're breaking, we can take a moment to kind of reassess where we're at, and then make a decision at that point. But what we've seen in other districts where they have proceeded with either starting the semester without masks, they've had a considerable amount of illness, a significant amount of disruption, and I had hoped to have a document prepared by the University of Massachusetts Medical School. There's a set of researchers who have focused on the school districts in Central Mass and how those that had mask policies versus those that had not, how the rate of illness, the rate of disruption has varied in those districts, and those that have adopted face covering policies after starting without them have returned to a low incidence rate and a better sense of normalcy. So we're, our position is that we simply, again, stay the course until we can get a higher number of the student population in town vaccinated.
I just ask a clarifying question about, so these districts that started without masks, that was before the state mandate was in place, and then they had a higher incidence, and then once they were masked fully, they saw a decline.
Right. There are a couple, within, let's say, several miles of here that actually started their school semester off without face coverings, and they had, I think, over 100 students out the first week, and that's something that we've all experienced last March with when the British variant went through, and I think our objective is to provide a safe, secure, and a kind of a normal learning environment and an uninterrupted learning environment. So I think in order to keep the kids safe and provide that environment, it would be best to proceed with face coverings through until we can get the younger kids vaccinated.
I'm just concerned about time. I mean, I have a ton of questions, and I'm sure each of the other school committee members has a lot of questions too, while Mr. McAuliffe's here. I'm sure you're interested in hearing our questions
yes.
too, right? Okay.
So I think this is really pressing right now. I think
Yeah.
I would be more inclined to look down the agenda and shift some things if we run too far over.
No, but in terms of format, what are we doing here? Is it just
So I wanted to
are
let
we going to
him-
be able to ask questions too?
Yes.
Yeah.
Yes.
And is this where we have our discussion on what we want to do as a school committee? Or is that coming after? I just want to understand where we are.
This is where we are going to have our
Yeah,
discussion
right.
on how we feel and deliberate on
Yeah.
the information that we have. I don't know
Yeah.
if there's more, I don't want to,
I'd like Mr. McAuliffe to stay for questions though.
Yes.
Yeah.
but before we go into questions, I didn't know, I don't want to, I know I jumped in and asked a question just to clarify that piece.
No,
Do you-
that's, I
okay.
mean, I've got the majority of the data for for the town, and prepared to address questions.
Did you want to ask a question?
I do have a clarifying question on the Central Mass districts that you talked about. So do you have any data that says that those districts experienced in-school spread, or was it mostly from Labor Day travel and sort of the things that we were concerned about and that we also experienced in April or March of last year?
I can provide that's part of this research document that's coming in, because one of the things that we did see is we've seen a significant amount of spread, even just this week alone. The travel cases or the cases that we have that we're working on right now are all travel related.
I hear also anecdotally, I'm not a professional like you are, but I've definitely heard of a lot of travel cases as well. But I have not personally heard of in-school spread cases,
Not here.
knowing that we have cafeteria time that is typical of pre-COVID, I think, for the most part, and athletics that are outdoors, that are unmasked. And so far I've heard, unless you have data otherwise, I've heard that those are going pretty well.
Cafeteria and athletics?
Yeah.
Yeah,
Super.
yeah.
We have, I think, Mr. Cormier provided data on athletics. There are somewhere around 500 kids
Yeah, I
participating
think
in
if you add in
athletics.
the middle school, it's over 650 who are participating in athletics this fall.
And all of the outdoor athletics are completely unmasked.
Yeah.
You know, football, and contact sports too, so. It's encouraging to me that we haven't seen this spread.
And just to follow up on your question, my recollection of when the state mandate came into effect was that it was in place when we started school on September 1st, just prior to Labor Day.
Yes, for us it has been.
So the districts that did this would have been prior to when there are a couple that opened a week or so before us.
Yeah.
I think there was one private school that.
Okay, private
that-
schools, yep, I didn't even think of those.
Right.
I have one question and then one request for information for maybe, later. My question is, are those school districts comparable to ours in terms of vaccination rates?
Of high school students.
Yeah.
Yeah.
Because it doesn't feel like an apples to apples comparison if we don't have
It's
similar
not necessarily an
vaccination.
apples to apples. I can say that in one of the local communities that has almost an identical vaccination rate, they're in the midst of a spike right now where they've seen they went from having below 1 case a day, they're over 5 cases a day. So we're working with the DPH to try to figure out what is driving. I could generalize and say, Hopkinton, Ashland, Framingham, we're doing exceedingly well right now with our rates, while there are communities to our north and west that have seen an uptick, and we're trying to figure out what is driving that uptick. And then we know that we had, ours again was driven by travel, so that's one of the things that we're trying to figure out.
My request for information, I'm a person who believes strongly in vaccines and in herd immunity. But, we've been talking about breakthrough infection.
Right.
Now, what I don't understand is the other vaccines we get, right? The
Yeah.
DTaP and all of that. Obviously, we don't see people getting infected by those. But I'm sure that there's some breakthrough percentages for those as well. So it would be really interesting to understand how comparable the breakthrough rates for the Pfizer or the Moderna are, Pfizer I guess for high school students, versus the known breakthrough rates for the vaccines that we already sort of hang our hats on.
Right.
Right? So if they're semi-equivalent and we have this level of pretty much herd immunity, right, then that changes kind of my perspective on what's happening.
So the majority of breakthrough, so 37% of the breakthrough that we're seeing in Hopkinton is from Pfizer, in comparison to 26% from Moderna. J&J is at 4%, but J&J wasn't wasn't available to students, and then in general it wasn't widely available in this region. As I said, the majority of cases are being driven by Pfizer, and then out of the 135 cases that we've had since August 1st, it's like 26 of them were in kids under the age of 12. So it's
Yeah. No, it's super concerning, but I'd just like to know the comparables against vaccines that we already have FDA approved, that we know are efficacious, right? Like I said, we obviously don't see spread of those because we've had those vaccines forever and people aren't getting sick, but at some point we must have had those numbers. And it would be interesting to know that.
breakthrough rates for DTaP and other
Right,
things that don't
right,
get vaccinated.
exactly.
I agree,
What
that
would
would
it
be
are?
interesting. That, I didn't hear an answer on that.
Thank you very much.
I want to congratulate Hopkinton on getting to where we are, right? I mean, 95% plus vaccination rate, not just of the community, but of 16 to 19 age group, and even 12 to 15. So everyone who's eligible has been signing up. And I think 95% is close enough for a marketing person to say everyone. You know, I mean, it's very high. I know it's not everyone, and I can't read the numbers there, so I wanted to ask Mr. McAuliffe on the 16 to 19 row, how many are fully vaccinated individuals?
And the 16 to 19, let's see.
100%.
Yeah. And actually.
No, just
actually,
the number of fully vaccinated 16 to 19 year
So,
olds.
I think you might have brought up another question in a prior meeting.
Maybe, but this is my
numbers.
question now,
Right.
though, but yeah.
But, so what we did is today, after we spoke, I took the census data, the most current vaccine data I could pull aside, and we kind of broke that down. And we believe that the 15 is actually closer to 93%. So, that's 16 to 19 year old. It's, and what we believe drove that, and that's what we heard anecdotally during our clinics, was that they wanted a successful spring term. They wanted to graduate without event. They wanted to have as normal a graduation as they could, and they were preparing to go off to school. So there was a necessity to get vaccinated before they could start their orientation. So we believe that, the residents and then these kind of other factors help drive that high rate. So it's really a tribute, to what we've done here.
So 98% for 16 to 19 year olds. But again, what is the number we have up there? Or what is the, maybe I should ignore what's up on the chart.
It's over 95%.
No, the quantity, the volume, yeah.
They got 1,042.
Okay, and that's in your 98% calculation too, is that, okay.
And that's interesting because the numbers that you gave me earlier today, you have the 5 o'clock numbers, so there are two more people.
Right. So we've
My
had,
number says 1,040 and his says 1,042.
so
Okay.
we've had 12 more residents, so 4 more in the 12 to 15 get vaccinated, 2 more in the 16 to 19.
Great.
And then, and then we had 5 more in the 12 to 15-year-old group get their first dose, and 1 more in the 16 to 19.
So he says 98% of the 16 to 19 and 95 in the 12 to 15.
The state's reporting out 95. I
Yeah.
believe we're about 93.
Okay. Yeah,
Still
I mean, it makes
exceptional.
it tough, like I know those ages like roughly align to part of the high school population, so, but, I think we would be talking about high school masking policy tonight, taking advantage of the opportunity that the state has provided by recognizing that the risk is much lower for communities with 80% plus vaccination rate. And not only do we have that in our community, we have close to 100% in our schools, in our high school, right? So I think that we're in a good situation. I wanted to get clarification too on when I hear the health director recommend that we stay the course with masks, I hear reference to the flu and other respiratory viruses, but I believe the scope of our conversation here is COVID spread. So that, I wanted to get clarity from you on what you mean by that.
So, I was.
Sure, it would be great to prevent the spread of flu and other respiratory viruses by everyone continuing to wear masks in school, but no one gave us the authority to have mask policies for flu and other respiratory viruses. We haven't had public forums on that, and this state 80% thing that we're looking at now is for COVID, not for spread of flu. We should expect the flu spread to be greater if we unmask. But, we also need to all start building up our immunities again to these common viruses.
So today, in 2021, we've had one case of flu. We had 28 in 2020, 33 in 19. And then 2018, we had 41. And then we were in the 25. 2016 was a mild year. So there's been a bit of a reduction.
So
I would attribute.
I mean, I can understand the concern in terms of COVID. Like, okay, these symptoms look like COVID symptoms, and so the children will stay home because they look like COVID symptoms, and that could affect their schooling. But I think I agree with Joe in the sense of we have to discuss COVID. And as much as, you know, personally, I think it's cool that we're wearing masks and that all the flu rates have gone down throughout the states. That's awesome. But it's not our purview right now.
No, I think it's also important to remember that masks are, because of a federal statute, are mandated on buses. So we don't have the option. I mean, in a closed space of the bus, you have to wear a mask regardless. And the decision before us is whether we want to make it optional. I mean, lots of people choose to wear masks who are vaccinated for their own comfort level, or because they have the sniffles, or well, they shouldn't be coming to school if they have the sniffles.
Right.
But anyway, but you know, so I think it's perfectly fine, you know, for people to feel like that they want to wear a mask for their, you know, if they're just more comfortable until they see how things go. That's also an option. It's not that you have to take your mask off.
Go ahead.
You know, one point is that, you know, we've got 500 kids participating in athletics with communities outside, and as those sports start shifting indoors, they are interacting with kids that are coming from communities that don't have our vaccination rates. And then I would argue one of the problems with having a highly vaccinated community is that there's a greater, you have a lot more asymptomatic infection. So the face covering is just an added protection, or it's an added bit of protection, or an added layer of protection, so that if a child is in the school, you know, in school, and has asymptomatic COVID, that face covering is, in theory, holding more of that virus in, and there's less of a likelihood that it's going to spread throughout. I talk about my kids all the time, and I can tell you that in one of the pre-K programs, they followed all of the rules inside the school system, no problem. A classroom went to an off-site event, and where masks weren't well policed, and an entire classroom of 30 is now in isolation. I think about half the class has COVID, or there's a significant group in that classroom that has COVID. And these are the things that, you know, we're trying to, you know, we're just trying to build these layers and to provide protection.
Yeah.
So that.
Just ask one question back to the COVID, which I know, Joe, and I know you were talking about COVID, but in terms of rates, how many, I heard you reference a number, but I just want to make sure that I understood right. How many breakthrough cases have we had in now?
Since August 1st. August 1st was the start of our, what we call our surge.
Yeah.
Maybe tell us since August 1st and maybe since September 1st.
So August 1st, we've had 41.
And those are fully vaccinated individuals that have.
41 non-vax. We've had 135 cases. 41 of them were non-vaccinated, and.
So the majority were vaccinated.
Yeah. 32 of those were school age. I'm trying to think. Yeah. 41 of them were non-vaccinated. And then out of that 135, 86, 92 of those were breakthrough. With
And
50
were most of those in August, or?
No. I could provide a breakdown by month. I didn't prepare a breakdown by month.
One question, it's a procedural question, not about this. Now that we have a student council
Yes,
representative as part of our group, she's allowed to ask questions too, right?
Right.
So if you have any questions, please feel free to jump in.
All right, thank you.
Yeah, I have a question for our student council rep, if they could describe lunch, because we have kind of a pilot already underway in the schools where during the lunch period, which is kind of long, it's a couple of hours in the high school, you can't have a mask on and eat, right? And I'd like to hear what it's like in the cafeteria. Do people wear a mask when they walk around? And if my understanding is people walk freely in the cafeteria without a mask, and it's a typically crowded cafeteria, and they eat lunch without a mask. Is that how it looks, or?
Yeah, the cafeteria is definitely crowded this year, and some students choose to eat. There's like 5 tables. They're called the high tops out by the library, and a lot of seniors eat at those and remain unmasked at those, obviously, when they're eating. And in the cafeteria, it seems like so many people are in there just because we haven't had like everyone at school in a while. But to answer your question about walking around without masks, definitely it's like 50-50 kind of. I feel like some students do remember to put them on and like to take their trash to the trash can and they'll put them on. But also a lot of people are just used to having them off during lunchtime and they're eating. So it's just like the 5-foot walk to the trash bin. They don't have them on. But it definitely is crowded to a certain extent. And you're eating with all of your friends and masks are off. And there are a few tables outside that people eat at, but obviously as the weather gets colder, that's not going to be available. So it definitely has been interesting to see that kind of, like you said, pilot with the unmasked.
Can I say something?
Yes.
So, in my experience, in the lunchroom, people, when they eat, of course, they have their masks off, but when they get up, they don't put their mask on, they throw out their trash, which is okay, that's kind of acceptable. But when they like walk in the hallway after a cafeteria, they have their mask like here. So it's really no point wearing a mask then, because like it's not blocking anything. And I just think that I see a lot of kids, I see everywhere, like they just have their mask here, and like we constantly remind, like teachers constantly remind them, like they don't listen, and it's just like they don't really care about the policy of masks. So
Yeah, I mean, I'm interested, thank you, both insights are interesting. I mean, I ask because we have kind of this time period in the day where people are unmasked, and I guess my next question would be for the superintendent, have we had spread in the lunch period? Or any positive cases tracked back to the cafeteria?
We have had no spread, any transmission in any of our schools to date this year. So not just the high school, but all 5 schools.
We've had, in fact, a very low incidence rate.
Right.
8 since the start of the school year.
Even despite people walking around with a mask below their nose and things like that.
And how many of those 8 were high school level?
1.
And I would add that when they're walking around, there's no contact. It's not, it's, so, you know, it's one of the things that, you know, one of the things that really impresses me in Hopkinton is how well versed, you know, the students are in science. And, you know, there's a dose. You need an effective dose to become ill. And if your face covering is down and you're moving, there's a lower risk of you inhaling that effective dose. So it's when you're seated, and especially when you're dealing with Delta, but most of the cases right now are Delta driven.
Sean, I have a question for you. How would you feel if we were to take a course which hasn't yet been plotted by DESE to allow teachers to take off their mask when they're in the front of the classroom teaching? And if a student needs to come to the front of the class to give a presentation, they could take off their mask for a few minutes and then return the mask. So people would still have masks on their person somewhere, but there would be moments when you could, like this, see someone's face, which makes a tremendous difference. And am I speaking for a minute without my mask? You know, how much risk does that introduce?
Again, there are ways that you can layer in protection. I mean, they could, you know, the teacher could be 6 feet from the front of the class. The student who's speaking could be 6 feet to the, you know, to the side and stepped back. So, you know, DESE does allow, you know, for some consideration to for circumstances, you know, kids are allowed to take a mask break if they need it. So, you know, these are things that, you know, could be brought up for discussion and vote. It's all, actually, I'll check on that very question with Desi, because we're always allowed to create regulations that are stricter than our regulatory body dictates.
Right.
So we would need to do an assessment of whether or how that would go. But being that we're in this period where they are discussing, you know, off-ramping, there might be some leeway there, and that would be something that you could consult with DESE, council, and then decide.
Yeah, just so
Thank you.
everyone knows, I don't think that this has been stated at the meeting, that we have been granted the right to off-ramp if we want, based on those numbers.
Right.
Yeah.
So DESE is already aware of our numbers and would allow us to do that.
Thank you for saying that. And that, I have a question through the chair, is, or a reflection, is that we're hearing from our local health director something that's very antithetical to what the state is saying, right? The state believes it's safe for districts like ours to reopen. They wouldn't be giving us this right to do it if it weren't safe. I can't imagine there's another community that has a higher vaccination rate in our schools of 12 and above and in our general community. Yet our health director is cautioning that we should keep masks in place, which leads me to this reflection. It is up to us, elected officials, to make decisions that we think are rational. We can take input from experts, and we are, very respectfully, with all due respect, we have a state policy that is saying that we're among the districts most favored to do this mask off-ramping. So I think I saw over the course of last year at all levels of government kind of a confusion amongst policymakers on how to deal with scientific issues. And this is a case where it's coming to our level. We have scientific evidence, we have policies in place at the state level that allow us to do it, we have a high vaccination rate, we have the responsibility to make this decision. We can take input, but I think it's important to keep in mind that we're getting input from a health policy official who's, even in a community that has as high a vaccination rate as we do, the advice is opposite what we have as a policy allowed to us. So I'm taking that as an input, but I feel very confident, given the State Board of Education policy on off-ramping, that we're among the communities best equipped to do this. I do have a question for the superintendent. If we were to make a decision to off-ramp masking or make masking optional in a high school, for example, and then there were an uptick in cases, would we be able, under this policy, to reverse course?
I think it all depends on the wording of the motion that you would make.
Yeah.
So, and one of the challenges, I think, in terms of school committee is that you meet every other week. So in the event that you said you were in favor of off-ramping, and we made, say, for example, masking optional, unvaccinated people, according to the state, still need to stay masked in our schools, which is logistically a little bit tricky. But I think that you would have to word a motion in such a way that if we needed to revert to masking, you know, that could be a decision made at the superintendent level and would require a meeting of the school committee, because unless you were going to have an emergency meeting, you know, you could have a spike in cases, a spike in breakthrough cases, and need to have an emergency meeting, given the fact that, you know, we could be meeting tonight and we learn on Sunday that there's a spike, and we would still be almost a couple weeks out from your next meeting. So you would want to have a mechanism. So
Yeah,
that if you had to
emergency
revert,
meeting, yeah.
You would be able to do that quickly.
Sorry, can I ask one more? There's a couple logistical things that you've hinted at. One is masks would still be required for those who are unvaccinated. Again, with 98% of the 16 to 19 vaccinated and 95-ish% of the 12 to 15, I think that number is pretty small in the high school. Do our medical officials in the schools have a record of who's vaccinated? I
You would
believe
have a
they.
better answer to that.
Well,
than
I don't
because I
believe
don't
so.
know if public health data has gone to the school nurses or not.
I don't
thought
believe
you-
no, I don't believe they do.
Okay.
And that's something we should check on, because I believed that the school nurses would be receiving public health data on who did and who did not have a vaccination in Hopkinton.
I
But
would think.
if they do not have that information, then sort of the burden of proof, if you will, would lie with the student and the family. And so it would be, I know earlier, Sean, you talked about logistics. It would be very difficult for 1.5 nurses at the high school to collect all of that data and input it for about 1,200 students.
Yep,
And
that's okay.
faculty
Yep.
and staff.
Yeah, I
That's an awful
understand.
lot of work.
Yeah, I understand it's a lot of work. It could, I mean, it's some amount of work. 2% of the population would be unvaccinated and would have to be masked. So there's some work there. I wouldn't want to make a decision on this based on whether it's a lot of work or not, though. And then another logistical question is for public awareness, I think we also want to understand, like, what happens if we vote tonight to do this mask off-ramping. And my understanding is, and you can clarify, is that masks, if the masks are in place now and then we say masks don't need to be in place, that's considered a change in working conditions, and that would trigger a HTA right to impact bargain, which they have a right to under law, and we would welcome that if they choose to do that. And my question, I guess, is how does that impact the logistics or timing of what we may or may not vote tonight?
Well, I think if the state allows you to, on October 15th, do the off-ramping, and the next school day would be Monday, the 18th. I think if you said that you wanted to do this on Monday, the 18th, it would really limit the time that we would be able to meet with the HTA to impact bargaining in this. My belief, in consultation with legal counsel, is that you always have the management right to implement, but it would certainly limit the ability for us to engage in impact bargaining with the association, because we are, 11 days away from that.
Yeah, and from what you've talked with the state, you haven't heard of any change or accommodation for that. That's just how it plays out. Okay.
Correct. Impact bargaining would take place at the local
Yep.
level. I think Amanda, you look like you wanted to speak.
Just a more procedural question
Yep.
too. So we currently have a policy, EBCFA, face coverings on the books.
That we paused. Well, we haven't voted the new EBC. We have not completed that.
We haven't completed it, okay. So I was wondering if we as a committee had a directional vote to instruct the policy committee to write a revision for, our next meeting is on the 21st, is that correct? Is that an option? But, I mean, we have, not every district has a policy. Some districts just go by the state law. We had a policy, we had a practice of having a policy. So I'm wondering, does this factor into our process at all, or should it, or could it? And would we want to have, so that we have the language that Mr. Markey was referring to about without another vote, having the right to revert in the event of school spread? Is that the kind of thing that we put in the policy or in the motion?
I think that might be jumping ahead of where we are
Okay.
right now. I think that we could, if we figure this piece out, then the policy can follow what is that, but are there others who?
I'm glad you brought it up, because I think we do need to revisit it, but I'm sure we need to talk a little bit more before we do.
I thought that my understanding on whatever the masking policy was, it is what it is, but goes into effect or not, right? It's,
We did a first reading on a with some revision on
revision.
it. There were some questions on the particular types of masks. When we first discussed it, we had a couple of people who had asked if they had specific examples of masks, of whether or not those would be allowed, and we were looking
Oh,
for
yeah,
some expert
right.
opinion on that. I have a question regarding our school physician who practices here in town, and in addition is our school physician that we pay to help us with some of these matters. What has she said with regard to this?
So Dr. Boder and I had a pretty lengthy conversation today around noontime. Her fear around this is that she's just worried about some of the logistics of it and thinks that, I think she's in a similar place where Mr. McAuliffe is, that we should continue to use the masks because masks work. I mean, that's really where she is. I think she worries about things like breakthrough cases. She worries very much about our kids who are 5 to 11 who have not had the opportunity for vaccination. So those are some of the things that we touched upon in our conversation today. Go ahead, Sean.
I was just going to add, she's also our medical advisor, and one of the things that we've been discussing is that, there's a cohort here with, I don't know the size of the cohort, but of students that have a sibling that's in a younger grade that's unvaccinated. So that's something else that should be factored in here is, how does that affect,
Yeah.
or how could that affect, especially if they're, athletically inclined and,
Can I ask just a
Go ahead.
couple questions? One of them was, when you were talking about the logistics of the vaccination, are you saying you would have to, because you don't have the Department of Health data, that you would have to gather vaccine cards, or what is the
Yes.
logistical impact that you were talking
We
about?
would have to have proof of vaccination for, let's imagine it's 1,200 students. That is an enormous amount of work for a school nurse whose job is to be the school nurse. So if that person is working on, and the other thing that we're seeing now is that in the morning, our school nurses, when students aren't in school, they do make all the phone calls home to ask, what the symptoms are looking like, because that's a prevention method. So if, I call Nancy's mom, and Nancy's mom tells me that she's got the sniffles and a headache and a low-grade temp, Nancy's not allowed to come back into school. So those are the kinds of calls. That will take them anywhere between 90 minutes and 2.5 hours every morning. They're doing those kinds of calls, really as a mitigation tactic. And so it's really hard for them now to be nurses and to do all of this COVID work. One of the things I have in my slide presentation tonight is that we've got 15 kids who are close contacts at the Elmwood School who are all taking advantage of test and stay. It took 90 minutes to do all of the swabbing. We had one nurse, a principal, and an assistant principal doing the work. So the nurse, because she's licensed, can do the swabbing, but the principal and the assistant principal are doing all the timing because you have to measure it right at the 15-minute mark. So, it's an awful lot of work is going into this, and there's no possible way a nurse is going to be able to do 1,200 of those in that amount of time. We would absolutely positively have to hire additional help to do that, secretarial help, I think.
And then my other question is, obviously we have differing opinions and things like that. But I was wondering if we, give this a little more time, could you coordinate with Dr. Kavanaugh and Nancy maybe, and maybe we can come up with a plan for a pilot of some kind that seems fairly safe, that allows us to gather data that you'd be comfortable with, but that would also allow us to see, what can happen in the schools if we start to reduce masking. And so that was my other question, was whether there's a possibility of having a discussion to create a pilot that might feel better to, everyone than having just immediately get all the masks off and all the concerns that come with it.
Meg, did you?
Well, that's why I thought perhaps start with teachers who choose to unmask while they're teaching and see how that feels. And the kids get up and speak in front of the classroom. They'll still have 6 feet distance.
and you know, I can certainly sit down with, you know, the DPH and then break out data and do assessments to sit down and work with Dr. Kavanaugh.
I will say one thing that I am uncomfortable with, and I know that, Joe, you were talking a little bit about how we have people that are consulting with us and making recommendations.
Yeah.
I would be uncomfortable overriding the recommendations of health and medical personnel that we rely on to get us scientific, medical, health information that is beyond the scope of what our knowledge is. That we, you know,
Yeah,
we are not physicians or healthcare personnel.
you are.
I do work in the emergency room. I will say the piece that is also concerning to me is from working in the emergency room. I know probably a lot of you have seen some of the statements by the UMass hospitals related to the strike at St. Vincent's, the capacity being down at Metro West, as well as the Boston hospitals being very full, and on given days, 100+ people needing to wait to be moved from the emergency room to be admitted to the hospital. I know that that's not all COVID, but I know that that is a chunk of COVID that is indicative that even though it's not here right today in Hopkinton, we have community members working in healthcare facilities. We have them going into some of these communities to work where their rates are not as good as ours. The breakthrough cases are actually higher than what I had anticipated. I'm a little disappointed because I thought Moderna's numbers would be better than what you had said.
Right.
Yeah, if I may respond a little for the purpose of multiple opinions on the committee. I would say that when we have advice from consultants like public health director and school doctor, we must listen very carefully, very carefully. And what I heard is that the advice to stay the course with masks was to prevent the spread of flu and other respiratory viruses, which is outside our scope. So I listened respectfully, but we have to keep in mind what our charter is. And through the superintendent, what I heard is that the school physician was concerned about the administrative overload, and the superintendent clearly was expressing some emotion about the concern around the administrative load. So I'm listening very carefully, and I'm not hearing that this is a concern about COVID. And on the other side of the table, I have a policy for communities with 80% or above vaccination rate that masks are no longer required. And as you recall, in the beginning of the school year, masks, we were debating ourselves whether masks should be required. And a lot of people are wondering, when will masks not be required? If we start adding the scope to include the flu and respiratory viruses and administrative work involved in unmasking, we may never unmask. We might need to give the administration assurance that if we do vote to unmask, we would be looking at the caseload. Now, keep in mind, the superintendent also had said she's not sure. She's going to check to see whether the school medical staff has access to vaccination records already for COVID.
So those are not the pieces that I'm responding to.
Yeah.
I'm responding to, and Sean, I'll let you respond as well, but I'm responding to the breakthrough cases and the cases about the surge in Massachusetts right now. I understand that DESE has said that we are allowed to do that.
Right.
They did not come out and say they recommended do it. They said we're allowed to. And I don't know that that's enough for me to want to override what the people, the boots on the ground are
Okay.
here in
Well,
town.
we
Go ahead.
could
I
make
just
a
want
motion,
to
I
make
guess.
clear
Yes.
and be clear that my recommendation for face coverings is driven by COVID. It's an extra benefit, you know.
It's an extra benefit.
It's a benefit.
Of course.
It's a benefit to the town that we've had lower flu, RSV. So the less respiratory virus that we see in town, the less work it is for the school nurses to have to work through to figure out, is this COVID related? Is this RSV? Is this flu A or B? Is it the common cold? I mean, when when you see just the slightest surge in COVID or the slightest surge in RSV, it's taking away a lot of man hours in the school department, the health department. So if we can control for COVID, and that control is working just as well to control RSV, flu, et cetera, we should, I believe that we should take that opportunity and get that added benefit.
Okay, but with all due respect, you're not a voting member here.
Right,
I
right,
take that
right,
advice.
right.
But I would say we might make a motion that guarantees that the administration have adequate staff to handle that, because we believe there's educational benefit to students having their mask off. So, yeah.
So I just want to kind of direct things back
Yeah.
this way. But, you know, there's a lot of different things that we're hearing, a lot of things that we're considering. I think for me, and I know that most, if not all of you, would share the same goal, is to remain in person, fully operational, and not have any, and I know there was another district that got approved to pivot to remote, so it's not because they had such an outbreak, but my goal would be for that never to happen this year, for us never to go back to where we were last year. At some point, I would foresee that I would be comfortable and want to, you know, move towards that next step. Is it next week, the week after? I can't say, but I am not comfortable today, given the health recommendations that we're getting.
Okay.
But that does not prevent you for sure from making a motion that you feel strongly about.
Okay.
Are there others that wanted to? Go ahead.
When we took our vote just a few days in advance of the commissioner's edict, we took our vote, you know, it turned out we didn't really need our vote, but one of the things that I had said at the time was I was eager to see the actual experience that we have in our district and in other districts in situations where there is unmasking. So I am buoyed by the fact that we are doing pretty well. I'm assuming it's because of our vaccination rates and our ventilation and, you know, sort of those other layers that we casually forget to mention.
That's right.
But they're still there. Like, we have a lot of other things in place, and lots of hand sanitizer and everything else. So, I think our suite of intervention seems to be working, and in cases where we're unmasked, I'm happy that you're having lunch, we're having athletics. I know the kids are driving in cars together. I mean, kids are kids. A lot of things are happening, and we're very fortunate. So things that are important to me right now are ensuring that the climate in the school is such that each individual is comfortable doing what they're comfortable doing. So I think, to me, that's really important. I know a lot of people, for lots of reasons, feel comfortable in a mask. And I think it's important to me that, regardless of what our decision is, that we ensure that the climate is such, and that you guys, like, when you're thinking about your friends or friends who may have concerns, that we have an environment in which people are not shamed into unmasking or shamed into masking. Like, people should be respected without question for doing whatever it is that they feel comfortable doing. So for me, that's very important. And a lot of that comes down to, how we communicate this, because that is important. And we don't know, you can never know by looking at somebody, even if you're best friends, what their other circumstances are. There's always, a life beyond what you can see. So that's important to me. The recommendations of the health director are very important to me, as well as recommendations from the superintendent, if we have one coming forth. And I think the last thing that is really important, no matter what we do, if there is any evidence of school spread, if we see any cases that we know were passed from two kids sitting next to each other in class, to me, I don't want to wait for it to be 6 incidents like that. I would want to say, you know what, let's regroup, let's fall back, and reassess. So however we go about this, those are things that are on my mind. I think that Hopkinton has done an excellent job, and so I'm encouraged by that. I do take the concerns of the health director and the families who have younger kids. I didn't realize that younger kids may be vaccinated as soon as mid-November, which,
FDA has set a date of the 26th to review.
and some people are now eligible for booster shots,
Right.
I think, right? So healthcare workers
Yes.
probably another, so.
Teachers.
Teachers.
And teachers, so I think,
Yourself.
I think things are looking good. I don't feel like this is something that we're masking forever. To me, I feel like we're getting closer and closer, and I'm nearly there. I would like to hear a little bit more from the health director, about some of the questions that were raised, but I'm feeling like we're getting close, provided those other things are in place, the right culture in the school, the right environment. Mr. Bishop does a great job, so I'm sure it would be great. And I would love to hear your thoughts on any concerns around that. Am I
Yeah.
unnecessarily concerned, or do you think that's a reasonable concern?
No, I think the general consensus at the high school now is a lot of students have gotten word about the 80% and the fact that there is a choice, and a lot of people are really hopeful about it, I think, and it is kind of discouraging. Like with the 98% vaccination rate, I think a lot of students, if it continues to like wear masks, it kind of seems like it's never ending almost, and when we've done all that we can as 16-year-olds and 17-year-olds, and it's kind of like where's the end in sight, and what do we need to do in order to be unmasked? And obviously the situation is fluid and it depends on outside cases and surges and whatnot, but I think that's the general consensus that I've seen from everyone I've talked to at school. I don't know about you, Ryan.
I just think I think people like similar to what Jesse said. They're like really hopeful, like to like take off their mask and like stuff like that. But like there is like you said, as you guys were discussing, there's a precaution of having masks on, because you guys have worked so hard to put us back into school full time. Cause like in the summertime, like I was very scared, like oh no, like are we gonna go back to school? Like it's gonna be hybrid, like, and I was so grateful that we got to go back to school full time. There was no major outbreaks, very few cases. I think we got one case this week, but it wasn't that big. So I think in the current motion we're going right now, I think it's very good that I think a lot of students agree that some people we should have masks in the time being, but like as like the flu, like the season's coming, so it could like spark more cases. So I think students would not like to have masks, but
I don't know. If you're willing to entertain a motion, I'd like to make a motion, and I might need help from the committee to do it right. But I'd like to make a motion that we begin the process of exercising our right under the state policy of off-ramping masking at the Hopkinton High School. And I'd like to somehow work into that motion Amanda's comments about developing criteria for reevaluating or calling an emergency meeting if case rates warrant at your discretion to call an emergency meeting of the school committee to consider reversing. I'd like to work into the motion something about our desire that it be done respectfully, and everyone who wants to wear masks, whether for the flu or for COVID or for whatever reason, be encouraged to do so if they choose to. But I'd like us to begin the process of executing the state given right in Hopkinton with a 98% vaccination rate of 16 to 19-year-olds to off-ramp masking at the Hopkinton High School. Do you think I've said enough as a motion? Yeah. Would you like to repeat it?
So I think the essence of your motion is that you would like to make a motion to begin the off-ramping process with the Hopkinton High School.
Yeah, and understanding that there may be some work, both on our part and through impact bargaining and other things to finalize it. I'm not sure if that's true, but we might need to develop some policy or criteria on reversing course if it spikes.
I'm translating begin the process. I'm trying to decide what that motion means. What does that mean to begin the process?
Well, I guess I'd like to make a motion to allow Hopkinton High School students the option to not wear masks under the terms of the policy that the superintendent outlined this evening from the state.
Is there a second for the motion?
Do you have a date in mind, Mr. Markey?
I know we would be allowed to as of October 18th. Are we even allowed to vote prior to October 18th?
Yes, once you
Yes.
have your DESI letter
We
in
have the
hand,
DESI
which
letter
we
in
do.
hand.
Yes.
Okay. So we're already at, what's October 7th, so I think that in order to develop criteria, get answers to some of the other questions, we might need a couple weeks ourselves to know, for Amanda's concern, for example, if we need to have the superintendent call an emergency session school committee in the event that we need to consider whether to reverse. I think we need to have criteria for that, for example. And that might take us, when's our next meeting? 2 weeks?
21st.
Yeah. So do you have a suggestion on a date that would work?
No, I don't. I mean, I share Nancy and Amanda's concerns, and I'm particularly concerned about vulnerable students who have not yet been vaccinated, who have siblings in the high school, or teachers who have small children who have not been vaccinated. And if any small child resists vaccination as much as my son, I don't think it's gonna happen very quickly. You know, it's not like November's gonna come and they're all gonna get their shots willingly. So I would rather err on the side of caution. I've trusted the guidance of the Department of Health and Dr. Boder in the past. They haven't led us astray. They have, you know, encouraged us to return to school for the mental health of the students.
Sorry, this is a discussion at this point. There was not even a
Do you
second.
have to interrupt me?
Well,
while I'm speaking?
the rules of order are, someone makes a motion, if it's seconded, we have discussion.
So it appears not to have had a second. Is
Okay.
there a second on the motion?
Okay.
In that case, we can discuss
Okay.
and see if
Okay.
we want, if there's anything else that
Thank
we would
you.
like to
No,
consider.
I've had my say.
Not meaning to cut you off, but there are rules of discussion, so.
Yes.
Personally, I totally get that, you know, the students and the parents and everyone has done so much work. I mean, I am so freaking proud of our community for the vaccination rates, and the breakthrough infections are scaring me. However, I think, while I don't feel like we can open this up and just be like, oh, we're just going to drop everything, I do think that if there's a reasonable pilot that can come out of a discussion, that I would be willing to consider that, right? Something where we're testing out the ability of our school to be able to handle something like this. Something where, you know, we have like, this is what will make us stop. You know, this is what is telling us that we can expand the pilot to something else. Because I feel like that will give hope to the students and to other people. I feel like we can make sure that the Department of Health and our doctors all agree on what is reasonable. So that's my hope is, you know, nothing today, but if we could get information on a way to think about it that might allow us to take a step forward, that would be really nice.
I hear a majority of people, and jump in if people feel like I'm misrepresenting the committee, who feel that this is something that we ought to consider at some point, but not tonight. Is that?
I would really like, I mean, I'm taking this all in. This is for the community. This is the first time we five have talked about this. We don't get to talk, you know, just whenever we like, unfortunately. So it might seem a little messy, but this is how conversations go, and I think it's a really good conversation. I have a lot to process mentally from this conversation, and I would personally like to bring it for a vote on the 21st.
Okay.
In my mind, I mean, I am actually, you know, leaning toward off-ramping. I think that the high school, I feel that the high school is a really good candidate with provisions to roll back. But I have to process what I've heard tonight, and I feel like if we voted on the 21st, maybe with an eye toward November 1st as a start, we could make sure that we know if we have vaccination data in the schools, and we could learn a little bit more about those Central Mass districts and what exactly happened. You know, was there in-school spread, or was it travel related, et cetera? You know, I think I might feel, I don't process well in the moment. I think I might feel more equipped to cast that vote on the 21st, personally. But I don't want to put this vote off forever, because I think that we're a really good candidate, so I'd like to come back, you know, at our next meeting.
Okay.
A little bit more armed and ready.
Yeah, no, it's promising. I'm glad that we've engaged the conversation to start tonight.
I would just like a little more clarification if we are going to bring this back the 21st, which I welcome. So if we do unmask most of the high schoolers, but those who are not vaccinated or cannot be vaccinated for whatever reason have to remain masked, how does that not make them targets? And what are the steps we are going to put in place to protect them?
Yep.
Because that seems it's not worth it to me to have even a few students suffer from some kind of humiliation or teasing. So I hope we can think about that too.
I think that's a really great point, and I think worth exploring more before we, at our next meeting, as part of the discussion. So that was a lot. Thank you so much for coming and enduring a very lengthy discussion.
Thank you. I mean, it's if nothing else, I would argue that we are leading, and that's what we're all hired to do, is to take Hopkinton, to new heights, and I think we've done a good job at that.
And you have done well by the town from the beginning of all this.
Yeah. So,
Thank you so much.
and,
Thank you.
And I'll be in touch.
Thank you very much, yeah,
You're
thank you.
Thank you.
Welcome.
Okay, so that moves us then, we're going back in order, and I will be kind of shuffling some of the things that can be pushed off as we go through, but
I think
yeah, why don't we take,
considering-
Jane, sorry,
Sorry, I was gonna say, I know normally we put off policy, but I think considering the concern about the allergy one, that
I
we
don't
make
know,
sure
I
we
don't want to
keep
put that off. I want to make sure we take that as well. But there are some, including a report I was going to do, but I would like to invite Jane up to talk about the Upper Charles.
Bring a chair where this health director was, yeah.
Well, thank you. That was a very interesting conversation. Thank the committee for
First in the state.
for your very healthy discussion on all levels. And if I can just briefly say, I work part-time in a COVID testing site, just to add another insight, which has much less restrictions than Hopkinton. And I would say probably 60% of our cases coming through the drive-through for testing are students who have been in a classroom with another student who has tested positive. And because of that, all 30 students are dismissed until they can get a test, positive or negative. And so I guess my question for the committee would be, what is the policy for Hopkinton, and how are you going to handle that if there is a student, or maybe you already have a policy?
Yes.
We do.
Test and stay.
So,
Do you want to
anyway,
explain?
so our testing site is free. I'm not sure what Hopkinton, if there's availability for a testing site that's free, but, you can discuss that amongst yourself.
No,
because
they have an
that's-
answer, a quick answer for you. Yeah,
So at
because
the
the whole
high
community
school,
wants to know.
yeah, at the high school, if you are currently vaccinated and you're a close contact, you can actually continue to come to school. You have the choice of doing test and stay if you wish. So in the event that you're not quite sure, you can sign up for test and stay, and for 7 days you can get a rapid antigen test first thing in the morning
At the school,
at the school.
for free.
So I would also just throw out there, the majority of the students that we are testing
In which
are
town?
younger grades. They're
Yes,
not,
that is
they're
correct.
not available for vaccination right now.
Yes.
So anyway, so that's irrelevant. That's nothing to do with why I'm here tonight. But I find that it's very interesting conversation, and I appreciate all the hard work that all of you are doing. This is tough. This is tough stuff. Anyway, so I'm here on a completely different subject, which is continuation of the Upper Charles Trail from the Milford site to the Hopkinton State Park site. I'm chair of the Upper Charles Trail for the folks who are not aware of that. And we've been at this for about 9 years. And we've been charged by the select board to come up with a plan to build, plan, design, and construct a trail similar to the Milford Trail that will go from the Milford Upper Charles Trail parking lot to the Hopkinton State parking lot. Having said that, we have diligently looked at all types of alternatives. The challenge with Hopkinton is that much of the railroad bed, I would probably say 80% of the abandoned rail bed, was chosen by the town not to be bought by the town. So individual property owners bought it. So our job as a committee to try and figure out how we're going to get from point A to point B using town open space, small pieces of the abandoned rail bed, and pieces of property that we can purchase. And we've been doing that for many, many years. When the Irvine Tadaro property became a subject of conversation back, what, Joe, you were 2014 maybe?
Yeah.
It piqued our interest because there was a possibility of a trail going through the boundary, the landscaping boundary between the school property and private property owners on the other side. And we thought that that might be a possibility. And as it turned out, it is an allowable use under the town and the state guidelines. That is a possibility. So it, came up in those conversations multiple times, and it was recognized as being a possibility. Since then, we came before the committee maybe 2 years ago or a year ago and asked for the committee's support to support a pre-engineering study to investigate a segment of the trail that would go in our minds from the center trail, which the Board of Selectmen have told us that we have to incorporate into this conceptual trail, through school property, crossing the loop road twice, and exit through parts of the abandoned rail trail that are now underground, in that it's all wetlands, through to McDermott Trail, and it would end at Hayden Row. So that point, that was the piece that we asked for the school committee's stamp of approval, which the school committee voted to support that study. And actually it was a request to support grants for the money that we would get to study this project. We actually did that over the last year, and we have accomplished that, and now we are ready to go forward with final engineering studies, which would give us the answers that we need as far as wetlands impact and other, bridge, if we have to build a bridge, and other parcels like that. What we would also like to ask the school committee to consider is us crossing Hayden Row and entering, well, this wouldn't be the school committee's purview, but we would be entering the EMC parcel, the park is, And again, going through the boundary, the landscaping boundary, so that we don't interfere with anything that Parks and Rec is doing, circumference the boundary, and then entering the new Marathon School parcel around the outside perimeter that would be on the most easterly side, and then traveling around the outside edge of the property and exiting onto 147 Hayden Row, which is also owned by the town, but under the jurisdiction of the school committee, that I understand. And we're really not clear. You might be able to enlighten me as to whether the school committee has total jurisdiction over that second parcel or not. But in any event, it's not our intent to interfere with anything that the school committee may or may not see as a viable use for that property. We would be staying in the landscaping or the buffer zone so that we could continue this path from the center school, from the center trail through the school campus connector, crossing the street to EMC Park, and then traversing all the way around the new Marathon School connector to exit onto 147 Hayden Row. So what where our committee is requesting tonight is just maybe a nod of approval, just to support our desire to go after a grant to get pre-engineering studies, because we really do not know whether this is, we do not know what the wetland impacts are going to be. We don't know what other impacts we might foresee, and we're not going to know that without the knowledge, without the science. We don't know what we are going to run up about. So this is just a one-step process and a multi-step process in this whole big scheme of things. But it is necessary when we apply for these grants that we include people, which we would do anyway, but we would like to have your thoughts and any questions or any, and hopefully maybe a nod of approval that you would support us in this research approach.
Question. Nancy, is our approval required for this?
It sounds like in order to pursue the grant, you need something for us.
In order to pursue the grant, they're looking for a positive approval from multiple boards, wherever we are going to be partnershiping with, folks.
Thank you. Yeah, thank you for all your work on it too. As you know, I'm a big fan of that project.
Thank you.
Conceptually, right? There's a lot of could be issues with crossing Hayden Row and things like that.
It is a conceptual
I know that
plan.
we had our director of building and grounds here last time this was presented, and he took actions and followed up and met on the site, right? I would be a lot more comfortable if the director of building and grounds was here when we were to make a recommendation. I'd be happy saying something tonight without a vote, something like, just like we did with the Marathon School. We said we don't want to do anything in building the school that precludes or prevents a trail from eventually going through.
Right.
And I think equally, you don't want to do anything on the Todaro property that might preclude or prevent the town from building anything else there, right? But beyond that, I'd be a lot more comfortable having our director of building and grounds here.
I believe, we've been working with Dave Del Toro, our town engineer, and he has been including the facilities director in on the conversations. I haven't heard anything negative, but I also understand that the crossing of 85 really has nothing to do with the school property, which is the Irvine Todaro property, because we would be crossing McDermott Path, which is town operated, that has nothing to do with town owned, the school department, onto the town property, which we plan to, we've already heard from our engineers, to have mega impact, traffic signals and fancy flashing lights and all kinds of stuff like that, to the Parks and Rec Department, which, the town does own that land, but they have control over the facilities. So the town does own the land that goes down to the driveway. And then it goes on to the school property. So I'm not sure that actually falls in with the four corners of what the conversation would be tonight, as far as you're concerned.
I just have a couple questions because
Sure.
I don't know. So the whole center of Ring Road, is that all wetlands? So like, just inside the middle of the road where you have the Hopkins
the
School.
loop road?
Yeah, the loop road, sorry.
Okay, so we, in the first phase of it, which we came before you before, we had to work very, very closely with HALT, who oversees the conservation restriction of that property.
Okay.
And we did work closely with them, and we came to some terms and agreements and some language with the engineers who are overseeing the project, so that everyone was comfortable with the language.
I wasn't concerned about whether or not you had taken due diligence. I was curious because I didn't know if that whole
There is
area was
wetlands, and so that's what, and I'm glad you brought that up, because that's what these engineering studies tell us. They tell us what we need to do to go forward. If there are wetlands, what we have to do to mitigate it, and whether we do boardwalks, whether we do hard surface, whether we do soft surface, whether we do stone dust, the engineering studies will actually tell us that. So a lot of people want to know, what are we going to do with this? What are we going to do with that? And we say, we don't know, because we don't have the studies. And without the vote of approval from all of our partners for the grants, to go forward, to request the money for the grants, we won't get the answers. Now, of course, I also want to add that when we do get these answers, then we will be coming back to you again and saying, okay, this is what the science is telling us, this is what the engineers are recommending, and what is your input from there. We are also required to have multiple public meetings. We're, on all levels. So that, they're all good questions. And this is, as my friends like to say, this is just a baby step in a multiple step process as we go forward.
My second question just has to do with the other land. Is there any possibility that where that trail is going to be would be in the middle of, the Elmhurst rebuild or the growth of a school or anything like that? Do we know that? Do we know if any of that would interfere with any possible planning we would be doing?
So I think we should spend some time looking at a map, and I'm suggesting that because when you're working with the MSBA and we move into a feasibility study in January, we would want to look at every available parcel and sort of evaluate them if we are in fact going to build a new Elmwood school or a new 2-3 or 2-3-4 or whatever school we're building. So I would think it would be very important to take a look at that, because you wouldn't want to put a trail through a place where you're now going to build an elementary school, because then you either say we can't build an elementary school or we need to reroute that trail. So I think it makes sense to do our homework on the front end.
Mm-hmm. And I agree, and that's why when we were working years ago, we said we would only consider going around the periphery, around the outside border in the buffer zone, which is an allowed use, which the school committee couldn't build on anyway. So it would be in a landscaping perimeter, which is like 40 feet wide. So our trail of 10 to 12 or 20 feet, even if we needed to do rooting or whatever, it would still be within that 40 feet, which would not interfere with anything that the school committee would want to think about. But that's part of what the engineering studies would show and
Yes.
determine.
Yeah, but
I was
go
gonna
ahead, yeah,
say
yeah.
that. Thank you. Jane, I first want to thank you for persevering
Yeah.
as you have, returning to us year after year, because I really do believe that this Upper Charles Trail is a wonderful thing for the community and the connecting communities. So thank you for everything you do. I think what you're asking is simply just approval for you to apply for a grant.
That's
To
it.
do some more studies.
To do some
You're
more
not
studies.
asking us to say, okay, take over all the land.
Correct.
So can I please make a motion to allow her to do that?
So I want to ask just quickly, if I may.
Yes,
Do you
please.
have a deadline by which you need to have the vote for the application?
Thank you. Yes, we are planning to, the deadline is February 1, but we're doing all of our preliminary steps now. We're going before Parks and Rec and Planning Board and the school committee and all our other select board. We're doing all that partnering now, and as you very well know, that takes time.
It does. It does. And I also admire your perseverance. The procedural concern I have is that we don't have this on here to be a vote tonight.
Okay.
Would it be a hardship for you if we brought this back and you wouldn't have to come back and present again because we do have your materials, unless you particularly enjoy coming? We always like to see you.
I really enjoyed the conversation tonight.
You are always welcome.
But that would be wonderful. As long as you let us know
Yeah.
one way or the other, that would be great.
While you're here, could I just ask about that extension loop around the back of Marathon property? I'm just curious what benefit you see. I mean, I'm all in favor of any kind of non-automobile mechanism for getting around town because our traffic is crazy. But I'm just curious, what is the benefit there? Is it that you can get further down 85 without riding on 85? Is that the primary benefit?
So there's multiple benefits to it, and I'm happy to answer that. Number one is that we would be able to tie into the Blueberry Lane neighborhood, that whole Ash Street area, with spur trails.
Okay.
And in talking to some of the neighbors over there, they're very, very interested. It's not like it would abut them or go up against their property or anything like that. But, it may come within 40 feet of whatever. We've already looked at the developer plans in that neighborhood, and we feel comfortable going forward with that. The second thing, it's all town-owned property, so that when we apply for these grants, and our hope is that the state will, and the federal government will pay for most of this project, although we do rely on our Community Preservation Commission to donate substantial amounts of money as well, that it will allow us to come back onto Route 85. And from there, we do not know right now. We have a conceptual plan, but that conceptual plan is still not solid.
Okay.
The conceptual plan will be going before the Board of Selectmen, or the Select Board, shortly, because that conceptual plan has to be approved. Talk about processes. It has to be approved by the state. It's called an ENF process. It's the Environmental Notification Form. And in order for us to submit that plan, which is purely conceptual, so that we're still allowed to tweak it here and there, but it gives us an overall plan. It says, okay, we're going to go from the Milford parking lot to the Hopkinton State Park, and this is the route we're going to go. The select board has to put their stamp of approval on that. So that's just another level of process that we have to go before.
So Jane and I go way back. We've worked on a number of many issues together successfully. I just for all of our benefit point out that when we spoke about the trail through, while I was chairing the school building committee for Marathon, we engaged with the Trails group. And the difference in that situation was we had our engineers representing the school building interests already in place. And they knew the wetlands, they knew the wetland buffers, they knew where the property edge was, they knew where the slopes were. And we were able to work together with the trails to agree that we would try to build in a way that allowed access eventually by the trail through there, if that's where it ended up going. So we're in a different situation now, because we feel we may want to use that property at some point in the future, but we don't have an engineering team in place to represent
Right.
our interests on that site. Just something to keep in mind.
Thank you.
So kind of like the masking conversation, I feel like this is going to be a process that we're going to
It is a
have
process.
with you. It's not going to be a one-time in and out.
No.
We're going to, this will be
It's
an
just the
ongoing.
first step
Yeah.
of maybe the second step, or the third step.
We've seen you a couple
of many,
times.
many.
Yes, but
many
even
steps.
getting to your first step may be more of a process than you'd like.
And that's okay.
Yeah,
That's what this is all about.
yeah.
Thank you so much.
Thank you so much.
Thank you.
Well, thank you.
It's nice to see you.
Thank you. Thank you for all of your hard work.
Thank you, yeah.
Oops. All right, put this back together now that I just threw it in. Yeah, so it's tough times right now, challenging times, but we will get through this too.
Yes.
We will. We will.
Thank you.
Thank you.
Thank you.
Yeah, good night.
So we're going to circle back and go to our financial report. Mrs. Rotherman, if you could do that for us.
Sure. What I'll do is read through the cover memo, so it's something that the community can hear. The attached financial report indicates approximately 101,713 negative variance at this point in time. At this time, the negative variance is payroll driven. There have been 6 additional FTEs requests after the final budget was appropriated in the spring. 5 positions are for special education paraprofessionals and 1 position for a social emotional learning director. 2 paraprofessionals are covered by the ESSER grant for this year and next fiscal year. 1 paraprofessional is covered by the IDEA FY21 grant remaining balance. 1 paraprofessional is covered by the reduction in the need for the teacher of the visually impaired position. And the last paraprofessional will be covered by an increased use of circuit breaker against the out-of-district tuitions. The SEL director is partially funded by a grant. The payroll variance will continue to fluctuate throughout the year. At this time, there's approximately 24 open to hire positions, which includes crossing guards, cafeteria, long-term subs, paraprofessional, custodians, etc. The hiring market continues to be challenging. On the expense side, the out-of-district tuition has increased by almost $400,000 at this time. As you know, students change throughout the year and annually. This number may continue to change. At this time, the increase will be covered by grants and in the increase of circuit breaker. The other expense line that may change is special education transportation. At this time, Accept Collaborative is unable to hire drivers to provide transportation for many of our runs. Other expense accounts may fluctuate due to other market issues. For example, the plant where our vendor gets our copier toner has been shut down for 2 months. So it's early in the fiscal year. However, the pandemic continues to have its effects. The positions hired and student need changes will also have an impact as we begin our planning for FY23. So, are there any questions?
Well, thank you for the level of detail. Always appreciate that.
It's very worrying about the special education transportation.
Yes. It shows the entire market in terms of the difficulty of hiring for all kinds of positions.
So how do we
Hiring,
accommodate
driving,
that?
I'm sorry?
How are we responding or adapting to that?
At this time, we are actually asking parents to drive and we are reimbursing them for mileage. It's a difficult situation. Yeah.
Agreed.
Any other? Okay. Then that brings us into the superintendent's report.
Back it all the way up to that.
So, superintendent's report for Thursday evening, October 7th, 2021. In this report, we'll talk a little bit tonight about some enrollment numbers, and I've gone back and done a little bit of a 4-year history. I've got some COVID-19 update numbers, some pictures from our schools, and then just really quickly a follow-up on transportation. So I show you this one all the time, and I think, maybe the important thing about these numbers is that you can see where we have had the greatest increase in students. So, for example, there are 32 additional first graders this year. If you looked at the 2021 and the 2022, and the 21-22 numbers, what you'll see is that there are 32 additional first graders and 22 additional second graders. So those, I think, are kind of important numbers, and they're important numbers for us right now as we enter into budget season. So as I pulled out the enrollment history, I thought this was kind of interesting. What I did was I took 18-19, 19-20, 20-21, and 21-22, because I think that there's sort of a myth that the enrollment increases have leveled out or have stopped happening here in Hopkinton. So the columns going across, I have what was the projected budget? What were we budgeting for when we created a budget in that year? And then I took the October SIMS numbers and the June SIMS, which is under the end of year column. And then I looked at were the number of students that we got above or below the projection. And then if we looked from June to June, was there an annual increase or an annual decrease? So the first number under 18-19, where it says projected, we built a budget in the fall for that year, and we had budgeted on 3,557 kids. By the time we got to the end of that school year, we had 3,586 kids. So we were actually entering into a school year with a projected budget, but we had more kids in June than we did. We had more kids in June than we had actually anticipated budgeting for. And typically what you do when you budget is you say that will be the number that goes from September to June. In September, we had already exceeded the number we expected to have it in June, is what I'm trying to say. I'm maybe not saying that all that well. In that year, that was a huge increase year for us. So we had 184 more students than we budgeted for. But if we looked at the June to June annual increase, it was 155 kids. In 19-20, we budgeted for 3,844. We were 53 students above what we had budgeted for, and we were 156 additional kids in the June to June count. Now, when you go to 2021, which was the year of the pandemic, we anticipated having 4,111 kids in that year. And typically, we look at the whole year, so we imagine that that's what we'll have by the end of the school year. We did not. In October, we only had 3,933. At the end of the school year, we had 3,962. So while we were 149 students fewer than what we had budgeted for, we still had an annual increase June to June of 65 kids. So if we take a look at where we are right now, we thought we would have 4,024 students. That's what we budgeted for in this school year. And as I've said, that 4,024 says this is the number that we will accumulate, number of kids that we'll have by the time we get to June. At this very moment in time, we have 4,014 students, so we are 10 away from the mark. So between now and June, we really could only have 10 more students join our school if we were going to be right on target. At any rate, since last June, when we left school, and this date today, we are at 52 students from June to October, not June to June. So it will be interesting to kind of follow that out and see where we are at the end of the year. My guess is we are going to far exceed 4,024 if history continues to repeat itself, because we do get a lot of move-ins throughout the school year. So I did want to point that out, and if we went from the October 21, if we went from June of 2018 and we went to today, we have an increase overall of 428 students. Wow. That's an awful lot of kids. Yeah. I mean, if you think about 428 students, I think when I started working in Hopkinton, that would be as many as we had in an elementary school. So we have not built a school, but we have a school's worth of children. All right, new COVID-19 cases this week. This week we've had 2 students and 1 adult test positive. They are people who are at Elmwood and Marathon. So in terms of close contacts, we have 15 close contacts at the Elmwood school. And we have 10 close contacts at the Marathon school. So all of those people are eligible for test and stay. However, we have had parents who did not sign their children up for test and stay. You know, when we sent things out, they didn't fill in the spreadsheet, they didn't go to the CIC website and register their kids. And so right now, if your child is a close contact and you're not registered, we can't immediately register you. You know, the parent has to do that, and then there's a little bit of lag time by the time you get into the CIC system. So if you haven't done that and you're worried that what's going to happen is your child's going to be a close contact and they're going to be relegated to staying at home for a few days, please just go into that CIC website and register your child. It's super easy to do. If you don't have the link and you need it, you can contact any of the school nurses. You can contact Georgette in the central office, and we will help you get there. But there were some disappointed parents today who, you know, had to take their children home. So please get in there and register for that. I've already said this, but this morning, Kathy Bain, Ann Carver, and Jason Deeman, 70 minutes to test 15 children at Elmwood, and thankfully, all of those children were negative, so that's a wonderful thing. The time it's taking to do that, it was not so wonderful. But CIC has not yet been able to provide the nurses in Hopkinton with on-site testing support, which is something that they had promised us. I do believe that they are going to be able to send someone out to relieve our nurses tomorrow, which is great. You've already seen this slide. We've had 3 cases for the date range. We've had 8 cumulative cases since school started. And you can see each of the buildings where those cases have occurred. You've already seen this slide as well, so you know that our high school is vaccinated at 98%, and our, according to Sean, 12 to 15 are probably somewhere around 93%. And this was just a little bit of joy that I wanted to add to this. Mrs. Bolello, I go and visit each of the principals once a week, and a couple of Fridays ago, Mrs. Bolello and I did just some walking through the school, and we were just watching teaching and learning happen. And I'm not sure if parents know, but we have classrooms that are called co-trio classrooms. So there are 2 classrooms, and they each have a classroom teacher, and then there's a special educator and a paraprofessional who work there. So there are really 48 children across 2 classrooms with 4 adults. And I know that people say, how are we meeting the needs of all of our kids? And what you're seeing in those 3 pictures, this was happening simultaneously. So what you have there are 3 teachers. You've got Kristen Fumarola, Chrissy Sullivan, and Christy Ma, who's the special educator, and a paraprofessional, Kathy Grasso. And you are seeing exponents being taught at differentiated levels. In that first picture, you've got kids. There's a whiteboard in front of them just sitting on the floor, very engaged in the learning, hands up. In the second one, which is Kristen Fumarola's room, I don't think I've ever been in a classroom that was warmer or more inviting. Those kids are actually sitting across a long couch, and she is in that rolling chair explaining to them, you know, something about exponents, but just doing it a little bit differently from how you see the other classroom teacher doing it. And then in the third picture, you can see that Christy Ma is teaching a section and Mrs. Bolello's in the picture. But really, you are getting kids learning about exponents at 3 different levels. There are 48 kids, and you're probably wondering where are all the others, and they are all engaged in meaningful activity. And thank goodness for Kathy Grasso, our paraprofessional, who works well. You know, we're doing other kinds of direct and explicit instruction. So that was my joy. And I thought you might like this because Mrs. Rothermick was just very careful to tell us that we have 24 open positions and we can't hire cafeteria workers and drivers and all of those people. If you don't recognize the lunch server there, it's Mrs. Carver.
So Mrs. Carver's doing test and stay, she's doing lunch duty.
And that's the next slide. Yes.
Wow.
As you can see, our building principals are serving lunch, they're conducting COVID testing, they're hustling kids into the buses to make sure that the buses are on time, and amazingly enough, they are offering really high-level instruction. So, you know, it's a district to be very proud of because you can see great teaching and learning and you see the principal rolling up her sleeves and serving sweet potato fries.
Can we go back to recognitions and actually recognize the principals? Because that's unbelievable.
That is.
It is unbelievable. It sure is. What's new in transportation? So busing really has tightened up. Now the construction on Main Street isn't taking place. Things are going a whole lot better there. The timing of the bus routes continues to be reviewed, but at this point, really, the high school, the middle school, and Elmwood runs are all pretty stable. Like, we know what time they're getting to places, and kids aren't strolling into class late because the buses are late. We're still working on those Marathon Hopkins runs. We are currently conducting the mandated bus evacuations. You have to do that annually. And we have an open position in transportation coordination. So we'll be getting to filling that position as soon as we possibly can. And that's all I have for you.
Excellent, thank you. I have a question. Can you comment more on the marathon and Hopkins run? Is that what you said? Is there any part of the bus system that's still an issue? Because we got a couple emails come in the last couple weeks.
Sure.
I think it was about Hopkins.
I can certainly let you talk to that, but one of the other pieces I think we should talk about is gridlock. But
Right, I mean, construction and traffic has been an issue, obviously. So we have been working with the pickup times in the morning, especially, trying to get the students to school on time. So we had adjusted all the morning times earlier. The one where it's not working out as well is the Hopkins Marathon, where they have to switch, dropping off at one school, going to the other school. The difficulty is releasing those students and the contractual start day of the staff.
Oh.
So you can't release those students unless you have somebody to supervise. So we were running into not being able to release the students early enough to then get the buses over to the next school. So we have actually worked out with the schools now and with staff now to provide coverage earlier than what we had. So some staff have been able to shift their schedules. So the hope is that next week we'll be able to release the students off the bus. They'll be properly supervised. We'll be able to get to the next school and get there on time.
Okay.
But we haven't been able to do that until now.
Thank you.
And there have been times too where, just even exiting, say, the Marathon School and trying to get back out onto Hayden Row, as cars are trying to pull in, they can't pull in because no one can pull out, and they can't pull out because you've got two-way traffic going, that, anyway, there's a lot of people getting stuck actually on the Marathon property and can't come in or out.
Did we lose a crossing guard at the Loop Road entrance?
So we have two open positions for crossing
that
guards.
would have helped too.
It
Yeah.
surely would.
Yeah.
Okay.
So,
Thank you.
These are very difficult positions
Yeah.
to hire. We get 0 applications.
And I don't think Mrs. Carver wants to be.
I think she has 30 seconds between.
Is the police department able to assist in any of that?
We have discussed the crossing guard and traffic situations with the police department for several years. They run up against staffing issues as well. So they don't have the staff to take off of their schedule and put out there to direct traffic during our times. So so that's the difficulty with that.
Are you guys noticing a difference this year in how long it takes to drive? If you drive, I don't know if you drive or not yourselves.
The traffic has been crazy for high schoolers. Everyone, I think, I don't think I've ever had a class where I don't have at least 4 students trickling in a little late past the bell. It's been hard to get to school on time for everyone, I think.
Driving or buses?
Driving. I drive. Most of the seniors and juniors do too, I think.
I have some friends on the bus, and so we have a neighborhood. It's near the southwest side, specifically overlooking Greenwood, that area. And so the bus there, it goes into Greenwood. It comes around and it stops at my friend's stop, and it goes around all over again, and then it goes and it exits out onto Cedar Street Extension up to 85. So that takes a lot of time, he says, and well, It's for the traffic, I guess. Because last time it went on Saddle Hill, and I think he told me that the bus crashed with a vehicle or something like that.
Oh.
Yeah.
It's not good.
Yeah.
That's a hold up too.
Yes.
Something like that may or may not have happened. Yikes.
Are you getting many requests for bus stop changes? Because I have heard a fair number of people grumbling about the consolidated bus stops. I didn't know if that was something that was coming in still, or if that has.
Really have not seen, in the beginning, as happens in the beginning of every school year, so it's not unusual.
Okay.
So the number of complaints about consolidation of bus stops is not abnormal to what it is every year.
That's good.
It's, it's just a process.
Yeah.
But it has slowed down. The big issue right now is really getting the timing.
Mm-hmm.
And if the construction has indeed paused for the winter, then that will help us tremendously.
I thought it was paused for the marathon. I didn't
Yeah,
realize it was
yeah.
paused for the winter.
So I'm hearing a couple things because they said the paving is now supposed to last through the next marathon. So that means they wouldn't dig it up again, and the blacktop plants
Interesting.
close within a matter of weeks.
Right.
So
Okay.
if they do start construction again, it will be a very short window, maybe a
relief.
couple of weeks, because by November, the
cold.
blacktop plants close, they have to stop construction, because they can't repatch.
So that's a little bit of
So-
relief for our transportation.
So I don't know if it's indeed done, but that's kind of the rumor. Don't hold me to it. I'm not in charge of the blacktop.
Okay. So is that,
I'm all set.
you're all set?
Thank you.
Unless there are any other questions? So I am going to take out the listening to our report and put that off to next week to try to save a little bit of time. But the warrants 22-009, 22-010, and 22-011 have been approved and are in your packet. And then payroll warrant S22007 is approved, also in the packet. And then if there are liaison reports that are brief that should go tonight as opposed to in 2 weeks, go ahead.
Yeah, unfortunately, because of the date for this, in 2
Go
weeks
right
it
ahead.
might be too late. So we got a grant in the HFT from the Hopkinton Cultural Council to hold another active bystander training with True Story Theater. So the date is November 4th between 6:30 p.m. and 8:30 p.m. and it's for adults and high school age students. And it's a free community workshop presented by True Story Theater on Zoom. And its focus is responding to everyday bigotry, being open to receiving feedback, and engaging in constructive dialogue. The sign-up form is not available yet, but I think the 21st
Yeah.
may be a little late
That's
to
great.
bring it up. So as soon as the sign-up form is up, I'll probably put it on my Facebook site, and I'll send it to people, and people can send it around.
Anybody else?
Did we do the marathon love letters last time? And the video's out.
The video
It's a
looks
marathon
amazing.
love
Yes.
letters that
Yes.
the Hopkinton Freedom Team put together, and it is a beautiful video, and I really suggest everyone go see it because
Great job.
oh my god, I'm in it. But it's really awesome, and
It's
it's really
very well done.
positive. It's really nice.
Okay, so we're gonna go down through some of these travel things need to be done tonight just because of timing wise. There's a required amount of time they have to be done in advance, but they should be quick. I don't know if you wanna.
Yes, I can go through them super quickly. All right. Mr. Keller is actually looking to just change the date of Nature's Classroom. Instead of doing what he originally planned, he would like to move that to March and April of 2022. I think he was planning to go like in November of this year. And I think just for COVID reasons, he was hoping that, more kids will be vaccinated, that the virus will be under better control, and so he'd like to move that trip out.
And we did the same thing, I think, at the last meeting with the 6th grade.
Yes,
as well.
we did,
Yep.
yeah.
Questions or a motion?
I'd make a motion.
Second.
Motion by Amanda, second by Meg. All those in favor?
Aye.
It passes, and that brings us to the next one.
Can you mark me as a no?
Oh, I'm sorry.
I kind of liked the November date.
Okay, I'm
Okay,
sorry, I didn't
thanks.
hear that. Okay. So that's a 4-1 vote and still passes. So that brings us to the intent to travel for business professionals of America.
Okay, so this one is Mr. Scott, and it's Business Professionals of America. They have a state leadership conference. It's in Framingham. It's one night overnight, March 5th to March 6th, and that will be obviously next spring.
I'd like to make a motion to approve the intent to travel.
Motion by Amanda. Is there a second on that?
Second.
Second by Meg. Any discussion? All those in favor?
Aye. Aye.
Any opposed? Abstentions? Okay, so that also passes 5-0. And then we have another one from Business Professionals of America.
Okay, and I think that these two kind of go hand in hand. So the Business Professionals of America, they're going to go to a National Leadership Conference in Dallas, Texas. The dates are May 4th to May 8th. All of the chaperones are in the related materials. And you can see with the intent to travel for the Hopkinetics Robotics, they are also going to be going to that World Tournament also in Dallas, Texas from May 4th to May 8th. So you can approve them separately, but they are sort of essentially in the same place at the same time.
Okay.
Can I ask a quick question? Since, with trips that cost stuff, we've been asking a lot about opportunities for kids who do not have the ability to pay. I see there's some fundraisers.
Yeah.
Between these fundraisers, can they cover the entire cost of the trip?
I don't believe fundraisers will cover the entire cost of the trip, but if there are students with need, we usually will backfill what any of those kids need.
Okay, perfect. Thank you.
Is there a motion on the first one, the item E?
Sure, I'll make a motion. I just want to make a
Good, go
comment too, just if anyone's curious. The dates do fall aligned with AP exam testing. However, participants in these programs make arrangements ahead of time to take the exams so that they're not impacted. I just want to make sure people know that. And I would like to make a motion to approve the intent to travel for the BPA for May 4th to 8th, 2022.
Second.
Motion by Amanda, second by Meg. Discussion? All those in favor?
Aye.
Aye.
Any opposed? Okay, so that passes.
I'm on a roll.
You are. That brings us to Hopkinetics Robotics.
I would like to make a motion to approve the intent to travel for Hopkinetics Robotics, May 4th to 8th, 2022.
Second.
Motion by Amanda, second by Meg. Discussion? All those in favor?
Aye.
Any opposed? Okay, so that also passes, and that brings us down to the Marathon Designer Award.
Thank you. In your packet, you'll see a memo regarding the designer award for the addition to the Marathon School. Request for qualification was advertised on September 1st with packages due September 22nd. There was a pre-proposal briefing that was offered. Ultimately, 25 firms requested the bid package, 6 firms attended the pre-proposal briefing, and ultimately 2 firms submitted. We did have a conversation with the firms that attended the pre-proposal and just asked why they did not submit. They recognized that DRA was also at that briefing, and it was a business decision not to submit. So the 2 submissions we received were from Drummy Roseanne Anderson and TBA Architects. Collier's project leaders, who is our OPM for this project, did the procurement and the review with approvals through the Director of Finance. The matrix that was put through had DRA did rise to the top in terms of putting forth. So we are looking to enter into fee negotiations and ultimately a contract with Drummy Roseanne Anderson for the designer scope of work for the Marathon Elementary School addition.
Thank you. Any questions on that before we move to a vote? Is there a motion that somebody would like?
It's excellent. I mean,
Oh, yeah.
thanks for the update. We wouldn't be aware of the whole process behind it, so thank you. And because we don't, unlike we don't have a committee for this because it's not an MSBA project, but
Right.
rather at town meeting sometime in the past year, we had a town meeting and town meeting approved going forward with this. So now we're at this stage, so that's great.
Yeah.
It's for the addition to
Right.
Marathon School.
Alleviate some of the space issues there.
Was that a motion?
Yeah, what exactly are we looking for a motion
You're
to
looking
do?
for a motion to approve the Director of Finance to negotiate and execute with DRA for the Marathon Elementary project.
All right, so moved.
Is there a second? Motion by Joe, second by Meg. All those in favor? Aye. Any opposed? Okay, thank you. So that brings us down to policy JLCCB, life-threatening allergies. I applaud you all for hanging in there. So would you like to start with that, Dr. Kavanaugh? I know this is a first reading and not intended to be moved out of, not intended to be passed tonight, but to be reviewed and will be brought back for subsequent readings.
Shortly. So the policy working group met to take a look at Hopkinton's life-threatening allergies policy. And just to be clear, we have to remember that the policy is under the purview of the school committee. And policy is typically, at that sort of 30,000 foot view. And there are also documents in the district that cover the protocols and procedures, and those are operational, and those are typically under the purview of the nurses. And so what we had the nurses do last summer was to go back through their procedural documents and just make any updates that they needed to. And once they finished with that process, the policy working group was able to look at the nurses document and then kind of put that side by side with this particular policy. So when we did, there really wasn't anything in the policy, which had not been reviewed since 2014, that we felt we needed to change. And so we thought we would bring it to the rest of you so that you would be able to put an extra set of eyes on it. But we believe that what this policy says is reflective of, or at least sort of governing over what the nurses actually do on a daily basis.
Okay. And are those?
These, yes, so these are
Also-
documents here, if you would like to see them, are what the nurses do on a daily basis. I know that Meg and Leah, you probably have already seen these, but
Yes, they are very
5,
thorough.
6, 7, enough for everybody. All the way over
Through
to
the chair, could I
our
ask a
newest
question?
members.
Thank you.
Sure.
And these are procedural, is that
These are
accurate?
procedural,
And
yes.
But relevant to the conversation with regard to the policy. I will note that we had a few public comments on these.
Oh,
Because we
okay,
were
got it.
part of
There
the
you go.
policy.
Yeah.
Sure. You can
Uh,
hand it to the, yeah, I'll
It
bring it over.
it would take a little bit to go through. Some of it seems to be procedural in nature.
Yes.
In terms of the public comments, I believe you are copied on all of the public comments as well.
Nancy? So I have a question to make sure I get it.
Yes.
So, because at the beginning of the meeting, we had public comment that really was disturbing to hear, right? And we also had some emails kind of saying, how dare the school committee not have a policy? Well, we have a policy, and at the level that policies do, would prevent that kind of activity that we heard about in public comment. And I'm just looking for validation. And you're saying that the breakdown was more in the procedure level, or was it in the enforcement of either the policy or the procedure? Can you say anything about the example we heard in public comment?
Yeah, I think that I would rather not discuss
Yeah.
the example. We typically don't interact with people who, kind of come in and do their, a public comment. But what I can say is that if you, according to the document that each of you has right now, if you are a family in Hopkinton who has a child with some kind of life-threatening allergy, there's a set of procedures in there for you to follow, and so too for the nurses, and so too for the bus drivers, and so too for the teachers. We do train the bus drivers to use an EpiPen. EpiPen use for non-licensed people in our schools is voluntary. However, if you have a child with a life-threatening allergy in your classroom, being familiar with that child's individual healthcare plan, the IHCP, it's not voluntary. And so, typically we give you that child's plan. We ask you to review the plan. We make sure that, with the nurse, there are no questions There's an icon in Power School that allows people to know that a child has a life-threatening allergy. So all of those pieces for prevention are in place in our schools.
So hypothetically, if there were an incident in our schools where there was a student with a life-threatening allergy, and you're confident that our policy as written and the protocols and procedures should prevent it? So if there were an incident, it would be just a lack of compliance with those? Is that hypothetically, I guess?
And I don't want to say that I would say that I would be confident that all this policy and those procedures would prevent that, because we have to remember that. And this is one of the reasons why we don't say that this is a nut-free classroom, for example, or a latex-free classroom, because there's never a 100% guarantee that latex or dairy or eggs or nuts won't find their way into a place like that. But I think that as a school district, we are doing the things that it says we should be doing here. And is there an opportunity for error? Yes, there's an opportunity for error.
Okay, thank you.
Can I ask a question about the document that we are looking at here? This is district-wide?
District-wide, yes.
Are there other protocols that would be specific to, say, like Marathon School, where kids are a little bit younger, or a lot younger than the kids at the high school, or any of the in-between schools?
I think that it does address developmentally, appropriate procedures. So like in some of those documents, you'll see, it will say, would you allow a student to administer his, her, or their own EpiPen? And at some point, a physician and a parent may agree that, yes, we would allow that to happen. Sometimes a fourth grader will do that. Sometimes the kid wouldn't be comfortable with that, even, in middle school.
So, sorry, I'm just tying things together right now, but there's a paragraph in our policy that says it is the school committee's expectation that specific building-based guidelines and protocols will take into account the health needs and well-beings of all children. It is the policy of the school committee that the guidelines shift as children advance through primary grades and through secondary school. So we have this like district-wide thing, but the building specific thing we don't have. Is that I guess I'm not understanding the comment I just heard.
Yeah. At each building, people are trained differently and there are different things in place. So let's imagine I'm a first grader at Marathon School and I go through the cafeteria line and I am not supposed to have something, say for example, with dairy on my tray. But I get to the end and I have a cheese stick there. When the person who is kind of bringing through my lunch, whatever I've chosen, if I'm not supposed to have that dairy and there's a cheese stick there, there will actually be a red flag that comes up on that machine that will say to that person, that kid should not have dairy.
That's great.
Yeah.
Based on the ID, but
Yes, based on when we scan the child's ID, what goes through is it will say, boop, alert, no dairy, and that person will look at the tray to ensure that the kid has chosen a dairy-free lunch.
So there are a few specific things that are procedural that are in the email that we did, one of the emails that we received. It sounds like the icon is in fact working, that alerts
In
Power School.
Yes, we do have an icon there.
This document here, as well as anything that would be more granular to the schools, is there an annual sign off or something that we know that the teachers have received the training and is there a way that we track it, I guess?
I would have to check. I know that we have teachers sign off when they get a 504 or an IEP. I'll have to check to see if we have them sign off when they get an individual healthcare plan.
So it's hard, just because this is a large document to kind of process on the spot.
Yes.
I was looking for the email. There was one email that came in that said specifically, I
That's
would
what I'm looking
recommend
at.
these changes.
Yep.
That's what you're looking at.
I
Okay,
am
good.
looking at that, and I'm
Yeah.
trying to kind of sort through, you know, the procedure does not belong to us specifically in terms of the responsibility of it, but it is our responsibility to make sure that what is supposed to be in place in the policy is in fact either in place or that we change the policy to match what a safe practice is that is currently in place, if that makes sense. for my-
And that's what that's what we were working on with this
Okay.
policy, was trying to match that very large document with the policy. that
Oh,
we
right,
have
because you
presented.
guys have already had the opportunity. Are there changes to this is not a red line version we're looking at, this is the original policy?
Correct.
Are there recommended changes to the policy? It sounded like your assessment of the policy after the nurses went through some stuff was that it's not the policy itself that is problematic.
And we did have the nurses look at the policy.
Yeah.
We had a discussion, and then we sent them some material to review, didn't we, the nurses, Dr. Kavanaugh? And they reviewed this packet, and
We had this packet in place for a very long time. And we did send them what a couple of other school districts have in place.
Right.
So they worked on that to do some revisions over the summer and then got it back to us in, yeah, I would say late August, September, yeah.
Are these available to parents upon request to look at this?
Oh, absolutely, sure.
I assume so, but I wanted to make that clear that parents who had concerns would be able to do that. Are there questions related to,
Does anybody have that email handy? Because it listed like I'd recommend the following
Yep,
few
so
changes to your
Better
policy.
signage on the door, is that one?
Yeah, yeah, yeah.
To know who is trained to administer an EpiPen, no balloons in school, latex-free gloves for science labs, cafeteria workers, custodians, only latex-free pencils and erasers for all classrooms. This was obviously latex-specific sensitivity.
And are those policy level or is that procedural? Are those covered in our policy today or?
Those are procedural, and I think that in there's one of the sample letters that the nurses would send, does say to, dear family, your child has a person in his or their classroom who has a latex allergy. It means you can't bring in this, and this. But, again, I know that there are, nothing is 100%, so in the event that someone comes to the front door of the school and says, I want to drop off balloons for Susie Q, now we'd have to say, you can't bring latex into our school. You know what I'm saying? Like, we have to always be on guard to ensure that latex somehow isn't walking through the front door.
And that is what you do or you're?
We do,
Yeah,
we've
yeah,
switched
yeah.
out a lot of the
Right.
PE equipment to ensure that it doesn't have latex. The
Yeah.
teachers used to have those tennis balls on the bottom of the desk so you could slide them around without scratching up the floor, without having the kids go, "Arr," as they were moving the desk. And all of those had to be changed out so that they would be tennis balls without latex.
what about, I know erasers and some things like that that are brought into school by students themselves?
Yes, and that's
Would
one of
have-
the things, like, you'll read in that packet that it will say, please do not send your kid to school with a pencil with an eraser on it. We will be able to provide your child with a pencil with erasers that are non-latex erasers. And you've got to hope that parents will adhere to that.
So there was another email that also had some recommendations. I just want to read those out as well. Each school year, students and families should be made aware of the following, and those who are more familiar with this larger packet can vouch for whether or not it's in there. The specific LTA policy and protocols for the school at which their student is enrolled in. The steps a family can take to discuss concerns if their student or they do not feel that the protocols are being followed or their child does not feel safe. The icon alerting teachers, coaches, staff, administration to their child's allergy, which is in Power School. The dates of the first aid CPR training of the teachers, coaches, staff, administration at each school. What date the nurse has met with the homeroom teachers to review the child's care plan and what the protocols are to be in the event of an emergency. Who has been trained and appointed to administer an EpiPen or Avacute to their child, and what is the proximity of all trained staff in the case of an event throughout their child's day. That the allergens which cause their student to go into anaphylactic shock are not in the student's space in which they are expected to feel safe and earn an education, which may mean families need to do a walkthrough with the administration or staff at the school prior to the start of the school year. Follow up with family to be sure that EpiPens or Avicu is current and the care plan is on file with until the school receives it. So those are procedural. So that, okay, so do we want to absorb the document and see if there are any changes that we feel need to be made to the policy? If there are questions related to the emails that we had that would be specific to the policy, and bring it back for a second reading. Does that sound?
Yeah, I mean, it's a huge document that you have to absorb, so
It is.
I think it makes sense for you to.
And does that?
Oh, sure.
So are we saying, so a lot of the suggestions we read in those 2 emails are procedural, and so we can't really say anything about them in the policy, but we're asking the superintendent to ensure that she looks at those and makes sure they're in their procedures?
Well, so what I was asking is to kind of take some of these things and for us to be able to look through this and to feel that you feel comfortable that the concerns that have been raised are supported appropriately in the we're not going to vote this document,
Right,
but
'cause
it
that's
is
not our
it is
purview.
connected to the policy itself. And are there any things that we feel need to be moved out of this into the policy, or is it truly all?
Okay, I guess I'd like to go
that.
further and ask the administration to check, because they're responsible for procedures.
Yes.
Not us.
Yep.
Could we recommend, I don't think we have any authority to tell you to do it, or ask even, but it would be nice if you could look at those emails that were sent to us, the school committee, recognizing that those are actually procedural under your purview, and tell us whether you think the procedures need to be amended to accommodate those.
To do that.
Yeah.
I'd add to that, I think next meeting when we talk about the listening tour,
Yep.
and we talk about, hopefully soon, maybe next meeting, our goals, I'd like to talk about ways that metrics that we might want to identify so that we can measure the success of our policy. And,
Absolutely.
And I think that is part of our job. Like, we put the policy in place, we don't
Yeah.
work on the details, but there are probably a few pieces of information we could say to Dr. Kavanaugh, like in June, we'd like to hear, or May, or twice a year, or quarterly, or whatever we think it is. Could we hear back on these couple of indicators that would let us know if this policy is working the way we intend? So that's definitely something that we can do.
Okay.
Agreed. Good point.
Just one more
Yep,
point.
absolutely.
When you spoke about the latex erasers and how parents are told not to send their kids to school with that, can we somehow make that more explicit, that instruction?
Oh, it's very explicit. I don't
Is
want
it?
you to think that a single email goes home. You know, I mean, I think if you were, you know, I'll give you an example, like someone like Mrs. Bilella will send reminder after reminder after reminder just to make sure that families are aware that, you know, an eraser can be lethal, right? Yeah.
I just didn't get any of those reminders.
Is it only the classes that
Oh, it
have
would
a
only-
child in
yes,
it that
that's
would
right.
be
It would
have
only
that
be if your
specific
child was
allergy
in a classroom with a student with a latex allergy.
or other?
It'd be nice for it to be more broadly disseminated, that information about latex, and not just to remind everyone in the community. I don't know if there's a way we can do that.
One thing I am noticing that maybe we can talk about at the next policy meeting is this doesn't have sort of a high level accountability piece, right? So it has, this is what we want, but it doesn't sort of have, you know, this is the group that's going to deal with if it doesn't work. Like, you know, the school principal and the nurse or whoever are going to sit down and do a review and blah, blah, blah. Like, at a high level, like what is our accountability piece on the policy level? So I think that's one thing we can do at the next policy meeting.
Yeah. Does that feel like you have enough feedback on that
Yeah, that's great.
to come back with us for a
We'll
second?
look at it again next week.
Fabulous. So that in terms of future agenda items, I'm going to bring back the ones that have been pushed off a couple of times. And are we, the other thing, I don't know if you guys have the goals. Did we where are we with that? That's,
Our goals?
yeah, in terms of that policy. Because that might be nice to tie in when we do the piece on the listening tour.
Yeah, I think originally, or last time we talked, we just said goals would follow the listening to our report because that would form some of our areas of focus. But we're gonna have to get our goals done before the end of October.
Yes.
Say.
All right, so then, any final things, people can email me for future agenda items or email Amanda or Carol. And I would seek then a motion to adjourn. Oh, you know what? We do, my apologies.
That's okay. As superintendent, I recommend the school committee approve the items by consensus as outlined in your agenda.
So moved.
So motion by Leah, is that a second by Meg? All those in favor?
Aye.
Aye.
Unanimous, it passes. Is there a motion to adjourn?
Yes.
Motion by
Second.
Meg, second by Leah. All those in favor?
Aye.
Aye, and we are adjourned at 9:36. Thank you very much to all of our guests and for everybody for hanging in, and welcome to all of you.
Yeah, thank you for sticking with us.